I'm ready.
You got it.
Hello, my name is Sarita. I'm here to do a physical assessment on you today. So it's going to be head to toe. Do you have any questions, and is that okay?
That's okay.
Okay. Can you state your name and date of birth for me?
Anna Wood, 1798.
Okay. And do you have any allergies at all? Okay. So who is our current president for me?
Donald Trump.
Okay. And what is the current day of the week? What is today?
It is Thursday.
Okay. So, Ms. Wood is alert and oriented ×4. So I'm just going to get your blood pressure here. Where is this? There it is. Oh, I'm missing my. This was here. /2/78. Sorry. Just going to get your pulse here. So radial pulse is 78. It is normal rhythm. It is 2+. And then also your respirations are 14. And then I'm going to go ahead and check your other pulses while I'm here. So your brachial pulse is 2+, regular rhythm. We'll just do this again here. Radial 2+, regular rhythm. And then I'm going to get your popliteal. Okay, 1+, regular rhythm. And then I'm going to get your dorsalis pedis. It's 2+ regular rhythm, and posterior tibial is 2+ regular rhythm. And so if her radial pulse was abnormal, then I would count it for 1 minute instead of 30 seconds. Okay, so I'm gonna go ahead and look at your skin. So have any problems with your skin at all? It looks, it is appropriate for her ethnicity. I don't see any lesions, any wounds, any bleeding or redness. Also, her skin is warm and it is dry. I'm going to check your turgor, so no tinting, so hydration is good. I'm going to check your cap refill, which is less than 3 seconds, so that is good as well. And so, let's see, so we're going to move on. I'm going to be checking your scalp. While I'm doing that, can you squint your eyes for me? Okay, can you smile and frown? Okay, and then puff your cheeks. So cranial nerve number 7 is in place, and then if you can bite down for me. Okay, so cranial nerve 5 is in place. So I'm going to just check your scalp. Do you have any tenderness at all? Okay, her scalp is white. Her hair color is brownish blonde. I don't see any bugs or lice. Her scalp is clean and no lesions. It's hard and smooth. Okay. Her head is erect to her body. It's midline. And so, let's see, we'll move on to, I'm going to check your tempo open and close your mouth for me. Okay, and I'm gonna check your temporal artery. It's elastic and it's a 2+. Okay, your eyes, her eyebrows are present, her eyelashes are present, her lids are moist. I'm just gonna go ahead and check your conjunctiva, which is pink and moist. Her sclera is white. And so I'm gonna shine this light in one eye, so I'm just gonna come around, okay, and then come around here, okay. So her direct and consensual response is good, which is 3. Then we're also gonna do your accommodation, okay, so check this here, okay, and if you'll just keep your head still, then follow with your eyes. So cranial nerve 3, 4, and 6 is in place for her eyes. Okay, and so your pupils, let me just go ahead and get your size. Okay, it's 3 mm, and they are round and they're symmetric, and so is her eyes in general are symmetric. Now, your ears. Okay, do you have any tenderness at all? Okay. I'm looking at her external ear. I see no drainage, no redness, no lesions. And let's see if this works today. Okay, so I'm going to go up and back. Okay, her canal has no odor, no drainage, no redness. Her tympanic membrane is pearly white and translucent. And then I'm going to, I need an alcohol pad. But I am going to step behind you. If you'll just cover this ear for me.
Okay.
And I'm going to step behind and just whisper in this ear. And if you'll just repeat after me.
Okay. 1, 2, 3.
Okay, so I would do that bilaterally to check both of your hearing. Okay, so let's see your nose. Your nose is symmetric. Can you hold this nostril for me and breathe? Okay, opposite side. Okay, then I'm just going to look in your nose here. Her septum has no deviation. I see no lesions, no masses, no drainage, no wounds. Any problems out of your nose? You'll close your eyes for me and tell me what you smell. Okay. We'll just go ahead and check both. Okay. So her cranial nerve 1 is intact. Okay. I'm going to go ahead and check your maxillary sinuses. I'm going to just palpate here, any tenderness. Okay, and then I'm going to check your frontal sinuses, any tenderness if there either. Okay. So as far as your chest goes, if you'll just breathe normal for me. Okay. So no effort in breathing. You've got a 2-to-1 ratio. I don't see any masses or lesions or bloody areas. Any problems with breathing at all? Okay. So then I'm also going to check your trachea. It is midline. Your carotid artery, I would check on both sides, not at the same time. 2+ regular. I don't see any JVD or any pulsations. Can you just do your neck rotate? Can you lean forward and lean back? Okay, and then side and side. Okay, and then just do a rotation. Okay, so muscle strength is or range of motion is good, and then if you'll just press against my hand. Okay, and muscle strength is a 5, which is good. Okay, so I'm gonna check your. Do you have all your teeth and tonsils?
Yeah.
Okay. So I'm just going to look at your gums, if I can get this going here. Okay. So I'm just gonna, okay. Your teeth are clean. I see 32 of them. They're white and clean and shiny. Her gums are moist. Your tongue, if you can stick that out for me, is smooth and moist as well. Her hard palate, okay, is pale. Her soft palate is pink and moist. Do an awe for me, okay. Her uvula is midline. It is freely movable, okay, and just awe for you. Okay. Her tonsils are a grade of 0. They're not swollen or anything. Can you stick your tongue out and move side to side, top to bottom, okay? So, your, cranial nerve 12 is intact. And then, can you swallow for me? Okay, so cranial nerve 9 and 10 is intact as well. Okay, so, we're gonna do your lymph nodes here, and I'm just gonna palpate. We have your preauricular, your postauricular, your occipital, okay, your submental, your submandibular, your jugulo-digastric, your superficial, superficial cervical, okay, and we have your deep cervical chain, and we have your posterior cervical, and then we have your supraclavicular. Any tenderness at all with palpation, okay, so they're not noticeable, so that's good. Let's see, so now we're going to, let's go ahead and do your upper extremities. Actually, let's just go ahead and do, I'm gonna go ahead and listen to, okay, just gonna listen to your lung sounds. 1, 2, 3, 4, 5, and 5. And that is anteriorly, and I would listen to them for as long as I needed to. And then if you could turn around for me, and we're just gonna do your posterior lung sounds. And do 1 and 1, 2, 2, 3, 3, 4, 4, 5 and 5, 6 and 6, 7 and 7, 8, 8, 9 and 9. And I would listen thoroughly for those. But lungs are clear, no ambitious lung sounds, and I know that's wrong pronounced. Okay, so your heart sounds, we're gonna go ahead and listen there. Okay, I'm gonna go to the right side of your sternal border, second intercostal space, and listen to your aortic. Okay, I'm gonna go across to your sternal border, second intercostal space on the left, which is your pulmonic. Okay, and then I'm gonna go to the Erb's point, which is the third intercostal space, fourth intercostal space, which is your tricuspid. Okay, and then I'm going under the boob here, and I'm gonna listen for 1 minute. I have 68, I have S1 and S2 noted, no murmurs with your heart sounds, so we're good there. Okay, I'm just going to specify where the heart locations are, just in case it wasn't clear. So we are on the right side of the sternal border, second intercostal space for our aortic. Then we're gonna move over for the pulmonic, and it is on the left side of the sternum border, second intercostal space. We're gonna go to Erb's point, which is the third intercostal space on the left side. And then we're gonna go to the tricuspid, and it is the fourth intercostal space on the left side of the sternal border. And then of course our mitral is our midclavicular line on our left side. Okay, so now we just need to, we're gonna do your upper extremities. Okay, so your upper extremities are symmetric. Okay, so can you just do fine motor for me? Okay, all right, and then if you can just move your wrist back and forth, up and down. Okay, elbow out, elbow up. Okay, shoulder up. Okay, shoulder down, the back around, okay? And then if you could just squeeze my fingers, okay? Okay, and then if you can just push against me, or pull back, push against me, and then arm out, okay? And then press down, and then push up, okay? So our range of motion is good. Your muscle strength is a 5, which is great, okay? So now we're gonna go to your lower extremities. And I also need, can you shrug your shoulders for me? Okay, so her cranial nerve 11 is intact. So then we're gonna go down here and I'm gonna look at your skin. Your skin is smooth, hair distributed evenly. Your color is great, so you have good blood flow. I don't see any edema. I'll put some gloves on and we'll check the bottom of your feet. That you're up here. Okay, the bottom of her feet are smooth and clean. No tears in her skin, no lesions, no breakdown, no problems in between your toes, so that looks good. Okay, so can you rotate your foot for me back and forth, up and down, okay? And then can you lift this leg up for me, okay? Put back down. And your hip, can you go to the side for me, okay? Try to press against this, okay? All right, so can you pull up? Okay. Can you push down? Can you push down? Okay. Can you pull up against me? Okay. Our muscle strength is good. I would check this bilaterally as well, upper and lower. So your muscle strength is great. Put your bed back in bed. Okay. Any problems? When's the last time you went to the restroom bowel movement?
Yesterday.
Okay. Any problems in urination at all? Okay. I'm going to listen to your bowel sounds. Your umbilicus is right here. It is not extruding. It is inverted, smooth. I'm going to listen to your bowel sounds. I'm going to do your right lower quadrant. Okay. Your right upper, and left lower. And I would listen for 5 minutes. Okay, so I'm just feeling, do you have any tenderness at all? Okay, and no masses or lesions present, skin is smooth and clear. And then also, too, on your pulses, those would be checked bilaterally. And your bowel sounds were normal active, so you're good to go, no problems there. And then, of course, anything that I've done would be bilaterally, especially your pulses, your upper and lower extremities. Not good stuff. So I'm gonna raise your bed back up. And there were no heart numbers. All right, Miss Wood, if you will, you're gonna can you turn around the side of the bed? I'm just gonna check your quadricep reflex, and I'm also letting you know that your muscle strength was 5 on your upper and lower, so you're good to go. So I'm just gonna check this. It'll just be a little small. Okay, so quadricep reflex is good. Okay, so that's everything.